North Korea's leader Kim Jong-un has mobilised the military to help stabilise the supply of medicines as the country battles a wave of coronavirus that's infected over 1 million people in just a matter of days. State media said Mr. Kim led an emergency Politburo meeting in which he rebuked officials, accusing them of failing to distribute reserve supplies. The country, which has few vaccines or tests, has reported another 400,000 cases of what it describes as fever and 8 more deaths. Well, for the latest, I'm joined now by our correspondent, Jean McKenzie, who is in Seoul for us. Jean, welcome to you. It's unusual to get so much information out of North Korea, isn't it? What's been said?
It is unusual for North Korea to be so open about what's happening in the country. I mean, of course, we can't confirm a lot of what is being said. We do have to take them on their word. But the fact that they are publishing every day that now these deaths and number of cases does suggest that in some way they are trying to speak to the international community, that it is being interpreted here in Seoul potentially as a cry for help. But interestingly, help is being offered to North Korea at the moment by the government here in South Korea and by others. And yet North Korea is yet to respond. It's yet to ask for help. It's yet to accept help. So it's an interesting situation, yes, as to what North Korea is trying to convey, whilst at the same time not quite being ready to ask for help. Because, of course, it has no vaccines. It has repeatedly turned down offers of vaccines, meaning that this virus is kind of spreading through the population, much as it was back in the early days of 2020 for much of the world. It's spreading amongst a population that is unvaccinated, that has very little built-up immunity and very limited ability to treat this. So it's a serious situation, but when and whether North Korea will accept help is what everybody's waiting to see.
Yeah, and do we know why it's suffering more than 2 years into this pandemic? Did it just reopen its borders in the short term, not long ago?
North Korea has tried for the whole pandemic to essentially shut this virus out. It has sealed its borders for 2.5 years, meaning that nobody has been able to enter, nobody has been able to leave. It's cut off virtually all its trade from China, but it's almost put all its eggs in this basket. It has been so consumed with shutting the virus out and convinced, I think, that it could do it, that it has been totally ill-equipped to deal with this eventuality. Now, we obviously see what's happening in China at the moment with this spread of Omicron, and it just appears that this Omicron has got through the border, we obviously don't know how, and is now starting to spread. Now, of course, we've thought that this claim that North Korea has not had a single case of coronavirus up until this point is unlikely, but it does appear that this is the first serious outbreak that they've had, possibly driven by the fact that we know that Omicron is more contagious. But the difference, I think, is that they've had all this time to prepare for an outbreak like this, and it appears that they have done very little to do so, meaning that they've now been caught off guard, thinking that this strategy of being able to keep the virus out would work, and now they are admitting that it has failed.
And Jean, just briefly, as you say, we're waiting to hear from North Korea if they'll take up the offer of help from South Korea. If they do, what could it mean, given they are so close, they are so secretive, and to allow South Koreans in would be huge, wouldn't it?
It would be, and to be honest, I think it's incredibly unlikely that North Koreans would accept help from South Korea. You know, we have heard that so far, even though this help has been offered for days, they haven't responded. I think what's far more likely is that North Korea will accept help from an international organisation like the UN. I mean, what's interesting, though, is here in South Korea, they have a lot of vaccines to give because most of its population has been double and if not triple vaccinated, but it's just now how those vaccines are packaged up as such. Do they have to go into the COVAX scheme and be distributed through the United Nations to make it palatable for North Korea? But interestingly, what health experts here are saying is that, of course, vaccines are important, but at the stage that North Korea is at, they're almost coming a little too late. What's most important now is trying to get the antiviral drugs into North Korea to treat the people who are suffering with the virus and to get that medical expertise and that medical help into the country as soon as possible. And that is what is going to be critical, making the difference between, people living and people dying.
OK, Jean, I know you'll continue to follow this story for us, but for now, thank you.